Hi, everyone, and welcome. Thank you so much for joining us on this beautiful Thursday evening and spending time with us. We are so excited to have you participate in today's webinar, Supporting People with Disabilities, Misconceptions and Etiquette. My name is Lynn Mattis, pronouns she and her, and I'm an alumni coordinator at Mohawk College. The Alumni Relations Department is here to support graduating students and alumni in helping you stay connected with the Mohawk community through events like this, communications, alumni benefits, volunteering, and more. Now, before we get started, while we are gathering in a virtual environment today, it is important to acknowledge the land we are on and to honor those who shared it before us. Mohawk College campuses, and where I reside in Mississauga, is situated on the traditional territory of the Haudenosaunee and Anishinaabe nations within lands protected by the Dish with One Spoon Wampum Agreement, and is currently home to many Indigenous people from across Turtle Island. In recognizing there remains much work to be done in improving this relationship and breaking down barriers that still exist today, as an individual, my commitment is to actively work to unlearn my bias, listen, and continue to grow my knowledge and understanding of history and Indigenous cultures. It is now my pleasure to introduce our two special guests for this evening. Emily Schaefers is a graduating student of the Early Childhood Education program here at Mohawk College and advocate and co-founder of the organization True Faces. Also joining us tonight is Hannah Schaefers, co-founder of True Faces. Welcome, Emily and Hannah. We are very excited to have you guide us through this important discussion this evening. I know we have a lot to cover, so I will hand the microphone over to you to get us started.
Thanks so much, Lynn. Before I even get so much into even introducing myself, I want to just take a moment and have everyone close their eyes. And I want you to picture a busy street. It can be somewhere you know well, or just a random street. And you're walking down the street and you come across somebody who has a white cane. They're standing on the street corner and they're about to cross the street. What would you do? Would you try and help them? Would you think people can't cross the street on their own? Do you let them just go on with their day? I just want you to start thinking about that. All right, so my name is Emily Schaefers, pronouns she, her, and I am one of the co-founders of True Faces. I was born with a genetic condition that caused me to be legally blind. So I've lived with this disability my whole life. My biggest concerns kind of are that I can't see distance or color, and I have a lot of light sensitivity. And I will pass it over to my co-founder, Hannah, to quickly introduce herself.
Yes, so my name is Hannah. My pronouns are she, her. I am 17 years old, and I was born with a condition called golden heart syndrome. This has resulted in me being born without my right eye and without any right hearing. On top of that, I also have a facial difference, which is a cleft nose, and that is me.
So in November of 2018, Hannah and I started True Faces, and it was essentially going to be a social media platform where individuals with disabilities could, individuals with facial differences could come and connect with each other. But we soon realized there was a lot of potential to expand to different disabilities. So now we are an online community for individuals with all disabilities, where they can come share their story, educate about disability awareness, and connect with others who are facing similar challenges as they are. We've started lots of different programs. We do speaking engagements. We're also a business with some merchandise, and we also have our lovely ambassadors joining us here today, who we'll introduce a little bit later.
So we started True Faces, as Emily mentioned, in November 2018. And me and Emily wanted to start this because growing up, we were the only people in our community with visual impairments that were our age. So we didn't really have anybody to talk to about our experiences and connect with besides each other, which, I'm so glad to have my sister with me, but meeting some different people was very exciting, but we didn't really get to do that until about high school, when we started meeting more people from like different areas in Ontario that had visual impairments that we could relate with. But we were so like touched by this experience, and we just loved being able to meet people that were similar to us, that we wanted to be able to provide that for other people, doing that via social media. So we really wanted to reach out to other people and share other people's stories, so that nobody had to grow up or live without somebody that they couldn't relate to. So we started with an Instagram page, and we, as Emily mentioned, we picked the name True Faces because we wanted to start off with facial differences. And of course, we quickly expanded. And the funny story is that the E was taken off of True because that Instagram handle name was taken.
People are always like, is it for some unique reason? And we're like, it was just taken already. So
yeah.
So April of 2021, last year, I had the crazy and wild idea at 3 a.m. that I wanted to start an ambassador program for True Faces. So essentially it was going to be a group of like-minded disability advocates who were passionate about sharing their story, their lived experiences, and issues that they've faced in their lives with other people. They've been helping us create content and running programs, and they've been an incredible asset to our program, which is why we brought some of them here with us today. We're joined today by Alicia Chenier, Taylor Gatto, and Jacky Rosen, who are going to be assisting us in sharing some of their experiences and how misconceptions have impacted their lives. Lynn, you can go to the next slide. So as that kind of mentioned, some things we'll be covering today are just a general overview of like what disability is, 8 common misconceptions, and along the way sharing some of our stories, and like I said, how these misconceptions impact our lives. We do ask that you please save your questions to the end, or you can put them in the chat and we'll address them when we get a moment. Next slide. Oop, I did it in the wrong order. We'll go to the next one as well. We already introduced ourselves. So disability means a lot of different things to a lot of different people. I'm super curious if you, before I say anything, have an idea of what disability means to you. You're welcome to put it in the chat. I'm always super interested to see people's kind of perceptions before they get to know anything about it. But all around, a disability can occur at any point in somebody's lives. It can be temporary, permanent, or episodic, meaning that it kind of comes and goes. It can get worsen, remain the same, or even improve over time. And again, they vary from mild to severe. So we have a couple of different disabilities with us here today as well, who will tell you a little bit about their, like I said, their experience and how their disability came to be. When it comes to the term disability, there's kind of 2 approaches, one being the traditional medical approach, where disability is viewed as a medical and health problem that prevents and reduces a person's ability to fully participate in society. And then there's the social approach, where disability is viewed as a natural part of society, where attitudes, stigmas, and prejudice present barriers to people with disabilities. So that may be your discrimination, your stereotypes, that sort of thing that kind of impede on somebody's ability to do something. My favorite ever definition of the word disability is that it simply means that I do something a different way. It is not my inability, but my ability to do it a different way. So next slide, please. So I will be starting off with misconception number 1, because this is something that I personally am very passionate about. And misconception number 1 is that disabilities do not change. disability in general is a huge spectrum, and it varies very widely from person to person. I only know of a few people with the same eye condition as me, but even the same people who have the same eye condition as me see the world and experience it in a whole different way. But additionally on that, disabilities also change within individuals. As I kind of mentioned at the beginning, disability can worsen, it can get better, or it can be stabilized though over time. So for me, my vision is essentially stable. So it won't change throughout my life. It won't get better. It won't get worse. But even with that, my disability feels like it changes on the daily because it is situational. So I mentioned that I have light sensitivity. So when I am inside and it's dimmer, I can see a lot more than if I go outside in the bright sunshine, because it's essentially like turning up the exposure on a camera. Everything kind of starts to get washed out and I can see a lot less. So I use a cane, but I use a cane when I'm outside and not always when I'm inside. So it's situational. And it's very dependent on different aspects that are in a room. So I feel like I wanted to talk about this one to just kind of emphasize that while somebody may need a cane one day and may not the next, they may need a wheelchair one day and a walker the next. I know people with chronic illnesses may be able to get up and live a normal life one day, and the next day they may just have to stay in bed, because disability fluctuates on a daily for, I feel like, the majority of people. Another thing is like my sunglasses. I almost always wear sunglasses, but then I come inside and I can take them off. And the most common thing I get is, "Oh my gosh, your eyes are so pretty," or like, "You have eyeballs." And it's just a part of my life and the day. But it's really important to remember to just consistently ask people about their needs, because they do often vary and change. And like I said, that goes for accommodations as well, whether it's in the workplace or education system, that sometimes we need something and sometimes we don't. But the important thing is to remember to just keep conversation open. And yeah, so that's my misconception, is that disabilities do not change. And I'm going to pass it over to our next speaker. So Lynn, if you can go to the next slide, who is Alicia, and she can introduce herself.
Yeah, hi everyone. My name is Alicia. My pronouns are she and her, and I'm from Sudbury, Ontario. So, fun place. So my story is I'm 22 years old and I am in early childhood education and almost to be a graduate at Cambrian College. I lost my vision at a young age due to a rare brain tumor, and I now live my life with tunnel vision. So I'm blind in my left eye and completely blind in my left eye, and I have no depth perception or peripheral vision in the other. So misconception number 2. Is that this next slide? I think. Yeah. All people with disabilities are the same. So this is in fact not true. For me, this affects me everyone with disabilities are completely different and always require different things, whether that be accommodations in a setting or just day-to-day life. For me, this affects me more as I gotten older, especially in high school. I found that it just started to affect the way that I got accommodations. There was a student who had vision loss previous years before me. And I have very distinct memories of teachers assuming what accommodations I need because they had previously experienced with that student. What worked for me was different than what worked for them. My teacher wanted to provide me high colored contrast paper and Braille like that other student because she just assumed that it worked for all students with vision loss. But I had told her, I'm like, I can't actually see that and I don't know how to read Braille. I do have low vision, but I was never taught it because I was able to see large print. So for me, I kind of had to tell her that my accommodations, I require large print papers with very big font. And instead of high contrast paper, I can only see black font on white paper. This also can apply to blind people and how the mobility stuff the mobility devices that we use. Most common misconception, within this is that all blind people use a guide dog or a white cane. That is not necessarily true. Some people don't even like, I think most people too don't, like with low vision, don't even use a mobility device. For me, I use a white cane on a daily basis, but when I get comfortable into a place, I tend to not need it as much unless there's stairs, then I will need it. And then another way that this is a misconception is all blind people are the same and see the same. But like all of us today, I think most of us have vision loss, and we all see completely different and in different ways. And this also can kind of go to accommodations as well, because I have had someone or a prof come to me and ask, oh, I have your closed captioning accommodation ready, like I do the other students. And then I have to go tell her closed captioning is for the deaf and doesn't necessarily work for the blind people, unlike video description. So that's a common one. And then what's something that we can do to maybe not prevent, but like to work on this misconception, is to not assume people's disabilities and their blindness, and to assume what their accommodations are. If you have questions or if you need to know how to support them, just ask them, because they're the best person to know the accommodations of a person with a disability is the person with a disability themselves. Yeah. And that brings me on to misconception number 3. People with disabilities can't do things. This one is very, gets me going, because throughout my whole life, I have always been told by countless medical professionals, professors, and even people in my field of work, which I'm in early childhood education, how are you going to do this? Or are you sure you're able to do this because you're blind? And if it's even possible. And I was always told at a young age too that I wouldn't graduate high school and end up in one of those special education classes. And all of this at a very young age was very discouraging. And honestly, it discouraged me, but it also gave me the fire in me to prove people wrong, because we people with disabilities are so much more. If anything, we put the ability in disabilities. So to me, these comments at a young age were discouraging, but I always change them. I was always questioned too whether I could do things just like someone else with sight loss, just like someone else with vision. And like even on a daily, I'm always asked like these just random questions. Just the other day, someone asked me, "How do you do groceries as someone with sight loss?" So I literally sat there and told them, I go to the grocery store and then I get a grocery cart and then I walk around the store and get groceries. I literally do it the same way as everyone else. And she was just mind blown at this. And I'm like, why is this such a big thing, like that we can do stuff like that? Like, oh, I'm breathing, how miraculous. So like, we do things the same way as everyone else. And even that, I can use a fancy app called Instacart. It's great. So yes, I'm blind and I can do my groceries. I was also able to graduate high school that many people didn't think I would do. And because of the vision loss, and I don't know why they always said that. They're just like, oh yeah, your vision loss is just gonna like stop you. You're not gonna succeed in life and this blah, blah, blah. And I was just like, you know what, with the right accommodations put in place, I was able to do it. And then especially, okay, and now within my own field, being in early childhood education, we had to go on placements. And for me, I was put in positions where I was, brought to, like, I went to a placement site and I had like all of the people there asking me like, and pulling me aside, like, so you're blind. How are you going to, watch the kids and like care for the kids? And is this even logical that you're here? And I told him like, yes, I have sight loss, but I wouldn't be here if I didn't think I was safe and the kids were safe. Yes, I need things put in place. I was really good with the kids, and I might need a little bit of support, but I'm still able to do the exact same things as them. And yeah. And then how can we better prove this in the past? We can assume people by not treating people with disabilities and not putting them down, have empathy instead of sympathy for people. Yeah, and just because having a disability does not mean our lives are worthless and not going to get anywhere.
Awesome. Thanks, Alicia. We'll hand it over to our next panelist on the next slide. Taylor.
Aha, yes. Hello, everybody. I am very honored to be here and to be speaking with all of these wonderful people today. I am a 22-year-old, soon to turn 23. If you want to call me a filmmaker, I graduated from the Bachelor of Film and Television program at Sheridan College last year, and I'm currently an exploring artist, figuring out what it is that I want to do with that. However, I know that I have a focus on wanting to amplify the voices of people with disabilities. I was diagnosed with Stargardt's macular degeneration, which is an eye condition, when I was 11 years old. This condition affects the central vision. So it's hard to imagine, but if you can imagine a big hole being in the middle of your vision and only having the surrounding vision around the edges, that is what I experience on a day-to-day basis. However, it doesn't stop me from doing the things that I love to do. And it actually has brought me to do what I'm doing right here, right now, which is advocating and sharing my story to help others understand. So let's get going with the misconceptions. All right, so misconception number 4, all disabilities are visible. So obviously this is not true. There are actually many people on this planet walking around that don't present or don't appear to be disabled in any form or way. However, there is a lot beneath the surface that we don't know about. And if you're going to be taking anything from what I'm about to share with you, it is to not make assumptions about people. I think when we think about people with disabilities, we think about what media has portrayed to us. We think about the worst case scenario. And a lot of the time, those things are visible, not all of the time, but a lot of the time, yes. But that's not always the case. Actually, a lot of people battle different disabilities that are walking around. They look like any other person. So I guess the expectation isn't for you to immediately know that someone has a disability, because here I am saying, don't make assumptions about people. But of course, how then would you know, especially if somebody doesn't disclose or share? And it's not about knowing, you don't have to know. It's about having the understanding and awareness that it's possible. You know, another option or another circumstance is a fully able presenting person does something a little differently. I think Emily mentioned before that having a disability it doesn't stop you from doing what a fully abled person can do. We just take a little bit of a different route to get there. And sometimes that route looks a little goofy, and that's okay, especially for me. For example, I hold my phone up to my face, like my nose is almost touching my phone. It's probably honestly easier for me to touch buttons with my nose than my fingers at that point. And I'm aware it looks different. People don't do that. Fully abled, fully vision people don't do that. However, if you stop and think about it for a minute and have that understanding and awareness of the different possibilities as to why I could be holding my phone close to my face, you might be able to get there on your own without harassing that person. For example, when I do this in public, typically older people will like to say to me, if you hold your phone too close to your face, you're going to hurt your eyes, which is offensive and mean and not thoughtful at all. And like I said, if they had maybe thought about that for a couple minutes before choosing to say that to me, maybe they would have gotten there. So when you understand and have the awareness, you can approach social interactions in your life in so much more of an open and respectful way. And then that way, if someone discloses their disability to you, you're not in an uncomfortable position and kind of awkward. I feel like when people find out that I have a disability, they don't know how to react. And that's typically when the unnecessary comments and questions come out, because they don't know what to say. But when you go in with the mindset that anything is possible beneath the surface, you're more prepared for what that person could disclose to you. So keeping that in mind, it's important to approach these conversations and approach these interactions with sensitivity. So for example, when somebody finds out that I am partially sighted, they typically say to me, "You don't look blind," which is, it's understandable, because when you're presented with the stereotypical blind person, which is cane in hand or dog on leash, sunglasses, rolling around, echolocation, of course I don't look like a blind person to you, because you don't know the community of blind people that actually exist. So a better way to have phrased that statement would have been to say, "I would have never known," and move on. Because that's true. It's not offensive. It's not claiming that, I should be looking a certain way in order to be classified as blind. But it's still a reaction, because at the end of the day, we're humans. And of course, someone would have never known that I even have a disability. So take away from that misconception is to not make not make assumptions, and understand that anything is possible underneath the surface. And when you apply that mindset in your everyday life, your social interactions will be so much more meaningful, respectful, and you'll learn so much more about people. So moving on to our next misconception, which is all disabilities are acquired and diagnosed in the same way. So this kind of ties into what Alicia was saying in regards to people with disabilities being put into a box altogether. And that's a very crowded box, because there's so many different disabilities, and within those individual disabilities, there's so many different conditions. And I think the four of us that are partially sighted on this call have made that very clear so far. 4 very different conditions within the same disability group. So when it comes to acquiring a disability, there is so many different ways. I think people typically think of a medical diagnosis, but for the sake of this argument, I'm going to speak to what I know best, which is the blind and partially sighted community. But I want you to keep in mind that these causes can also be applied to different disabilities as well. So to acquire blindness, for example, or being partially sighted, some of the causes, but not limited to, can be, you can be born with your condition, you can be born with the genetic condition, but you don't actually start losing your vision until later. You can go through an injury, you can go blind from medical reasons or illnesses. And then some people have complete unknown causes. And then there's some older people that just lose their vision because of old age. So these causes, yes, I just applied to being blind and partially sighted, but really you can take them and apply them to any disability. And yes, some disabilities and conditions are acquired in the same way, but it's important not to limit every disability to that same way of being acquired, because there's a whole host of different reasons and experiences that people go through when acquiring their disability. And when we come to diagnosis, now this is something that can be a very personal experience for people. And I don't want to say you need to tread lightly, but just have the understanding that when you're entering that conversation, it can be a very uncomfortable one for the person on the other end. And once again, there are so many different ways that one can be diagnosed. For example, one can be a baby when they're diagnosed, so they don't even remember being diagnosed. And then there's people that never find a diagnosis, or some people get a diagnosis that there is no reason why they have the disability or no known cause. And then there's some people that really struggle on a path to reach a diagnosis. And that's a very traumatic memory for them, such as myself. My story is very personal and traumatic for me. However, I am open to sharing, but not everybody is that way. And it's important to understand that it's not because of you. It's not anything that you're, maybe if you're being disrespectful, I don't believe that any of you would be disrespectful, but sometimes it's just not something that people are willing to open up and talk about, and that's okay. But understanding that acquiring a disability or condition and being diagnosed are two different things, first of all, and that there's many ways that they can happen. And they are both really personal experiences to somebody with a disability. And then my last point for tonight, which I really want you to remember and take into consideration as well, is that it is okay to ask questions. That is how we learn. This can be applied to both misconceptions that I just spoke upon, but questions are how we learn. That is how we get information. And especially when we're talking about topics that, you know, you don't really know anything about, you want to ask questions. But the important thing to remember is to approach those questions with sensitivity. Maybe ask the person if they're comfortable even answering questions, and read the room. Is this the time to ask questions? For example, once again, when people find out that I'm partially sighted, their first instinct is to ask me why I don't wear glasses. And typically it's phrased as, well, why don't you wear glasses then? And what they don't know is that I had 3 different specialists give me fake glasses because they were insistent on that I was lying. And so I basically went through my childhood wearing fake glasses, not getting any better, not getting any results for my vision. And so, yes, I did try glasses. But of course they want to know, like, that is something that, you know, one thinks about when you have trouble seeing, because in the ordinary world, when you don't really know about the blind and partially sighted community, you have troubles with your eyes, you go to the eye doctor, you get glasses, ta-da, magic is done. So they want to know, but the better way to have phrased that question would be, does your condition benefit from glasses? See, the same question, but phrased in a much more thoughtful and wanting to learn kind of way, and not in a way that is making the other person feel accused and insecure and uncomfortable. So ask the questions. I want you to ask the questions. But another thing to keep in mind is, as I previously mentioned, people aren't always willing to come forth with stories and information the way that the group of us are tonight. We are people that are speaking on behalf of our communities, but we are not speaking for them. So we want to raise awareness, but understand that I'm happy to talk about it, but somebody that might have even the same condition as me might not be. So don't make assumptions, understand the possibility, and please ask questions with a sensitive approach. Thank you, everybody.
Thanks so much, Taylor. Those were some awesome points. We'll go to the next slide. And Jacky.
Hi, everyone. So my name is Jacky. My pronouns are she and her. I am 37 years old. I'm not embarrassed to say that. I am probably the oldest panelist here. I think I definitely am the oldest panelist here. I was born in Toronto, still live in Toronto. And when I was born in 1984, people who have the condition that I have generally didn't survive. And if they didn't have a very good quality of life. So I was born with a congenital heart defect, which is called tetralogy of Fallot with absent pulmonary valve. Now, my parents realized about 4 hours after I was born that I wasn't breathing properly. And so that diagnosis was made the night of my birth. It was horrible for my parents. They were told I had a 10% chance of surviving my first 24 hours. And at that time, too, you weren't, now babies with my condition are operated on right away. And at that time, that didn't happen. You had to wait till you were strong enough to go through surgery. So I had a very, very challenging childhood. In addition, my heart condition impacted my lungs because I was missing a pulmonary valve. So essentially, I have a type of asthma, although it's not called that, it's called reactive airway disease. But as a result, I am more susceptible for colds turning into pneumonias. And obviously COVID is a huge risk for me. So I've been in my house for pretty much 2 years. And so I've had 3 heart operations. I have had 2 stomach operations that involved a feeding tube because my heart condition also includes failure to thrive, which means that I did not gain weight or grow. So I had to be fed through the night, every single night, through a tube in my stomach for 10 years. In addition to eating normally during the day. And the tube was taken out when I was 21. I also live with chronic pain, which has been the last 10 years of my life. It's made it a bit more of a challenge. And I actually, even though I don't have a vision loss technically, I do have an eye condition that does cause my vision to change on a daily basis. It's called map fingerprint dystrophy. Yes, that's a real thing. If you want to look it up, it's kind of interesting. But and in addition to that, I also live with obsessive compulsive disorder, anxiety disorder, and post-traumatic stress disorder. So my life is pretty interesting. But Emily, if you want to go to the next slide, I could start. So the misconception number 6, people with disabilities can't contribute to society. This is an absolute joke. We can all contribute to society in our own ways. I think when I think of this, I think about my career. And I did have a lot of trouble in my career just because employers aren't necessarily accepting of people who need a little bit of extra help to succeed. And it is changing now. It really is changing. I'm seeing a great amount of change in that sense. But when I started working after university, that was actually just happened to coincide with the financial crisis. So that was really great because it was all like trying to get a job with a disability, having to deal with the financial crisis and potentially losing your job anyway. It was not a good year. And I also had heart surgery that year. So it was interesting. But what happened was I used to be a journalist. I am not in that field anymore, but I spent the first 13 years of my working life as a journalist. And it was really, really hard to tell people, no, I don't have the energy because of my heart condition. I do have low energy. I don't have the energy to work overnight shifts. I can't do that. And I was told, well, in your job, you need to start working overnight shifts or you're not going to advance. And that was difficult. It was really difficult. And I think that the most important thing is that you have to, as a person with a disability, you do have to advocate for yourself. Because a lot of people don't understand. And unfortunately, until about 3 years ago, I faced challenges constantly that had to do with, well, you can't do this because of your disability. And it was a complete joke because maybe all I needed was a chair to sit down because my legs were tired. Or, I needed an extra couple of hours because if I'm going somewhere that involves a physical activity, it'll take me longer to do it because I don't have the same amount of strength. And I unfortunately did have a really negative experience where I was let go of at a job because of my disability, because the employer said that I lied to them about my accommodations, which was highly not true. It was a traumatizing experience. But I think the most important thing is that you have to stick up for yourself in that sort of situation. Because the truth is, as I said, people with disabilities can do pretty much any job out there as long as we get sometimes a little bit of extra help. Sometimes we don't even need that. So I did end up going to the Human Rights Commission and having a settlement with that employer. And it reminded me that I don't really want to necessarily be in that situation again. I changed careers and it has been amazing. I now actually work for Fighting Blindness Canada, which is how I met all the wonderful people here tonight is through that job. And, you know, to have an employer that understands your needs is absolutely fantastic. So just one quick little thing before I go on to the next one is that the principal of my elementary school, who never wanted me in her elementary school because she said that I was too difficult to deal with, about 30 years later sees me on television doing traffic reports, and all of a sudden is like, wants to get together with me because she's amazed by the fact that I'm on TV. Well, yeah, I can do that job. Did you not believe me? Did you not believe in me all those years ago? Anyway, to the next one. Okay, this is a big one. People with disabilities can't have kids. And let me start with the assumption that's even beyond that, that goes a little bit, you know, before that. People with disabilities can't have sex. That complete joke. We all have sex, believe me. So yeah, I know you're all laughing now, but it's the truth. We do. We sometimes we might have to have sex a little bit differently than the rest than other people, but we still have sex. But yes, we can have kids. And I think there is a common belief that, you know, that especially, you know, it's not so much anymore in 2022, but when I was a little bit younger, is that you shouldn't be passing on your genes or your problems to the next generation, or you should adopt, or, you know, you shouldn't have kids anyway because you have a good life. Why do you need kids? That's just, I'll just throwing that out the window. We can have kids. Again, it might take something like a little bit of extra help to either physically, you know, in a case of a woman or a case of somebody who's, you know, born female, getting the ability to get pregnant or anything like that, and then the ability to actually do the parenting side of it once the baby's out. So it does sometimes take a little bit of extra work, but we can have kids. I am the mom of a 15-month-old daughter. It was the most challenging thing I have ever done in my life, having her, but it was also the most rewarding thing I've ever done in my life. And it was a battle to get to that stage, to actually, you know, have to actually get to the stage of being able to say, I'm a parent now. I can't believe this happened, and actually, you know, believing it, because it was tough hearing from people like, you know, I don't know how you're going to manage carrying your daughter around. Like, how can you do that? And like, you shouldn't have any more kids because one is enough. And that's, you know, to balance out the side that's asking, when are you going to have your second? Which is really funny because it's like, well, we don't think you can have kids, but if you're going to have one, you should have two. But there's a lot of trouble to get to that stage. Originally, I was supposed to have a surrogate because I didn't think I could handle pregnancy. And that was a challenge because it didn't work out. And I eventually said, you know what, I think I'm going to try this and see if I can handle it. But even then, there's times that I didn't believe in myself and didn't think I could go through it. My pregnancy was extremely difficult on my body. And there were many days that I would sit and cry and go, I don't know if I could do this, but yeah, we can. And the other thing is, I know many, many people with disabilities who've had kids of their own. The other assumption is that automatically that if we do have, as I mentioned earlier, if we have a certain disability, that we are going to pass it on to our kids. That's not the truth at all. My mom did not have a congenital heart defect. My dad did not have a congenital heart defect. No one in my family had a congenital heart defect. So mine was random. And that's exactly, it just happened randomly for me. My daughter is perfectly healthy. She does not have a congenital heart defect. So we can have kids. And the fact is, because we have this lived experience, if our kids did have a disability, well, we would know how to handle it because we've been there ourselves. And that's what I have to say about that. So thank you, Emily, for having me on. I really appreciate it. This was fun.
Thanks, Jacky. And I think it's so important to your point of like, you know, you didn't believe in yourself at one point. So it's really important to have the people around you really feel that support and believe in you, and breaking down this misconception is the first part. So lift them up, tell them that they can do it because anything's possible. And I'm going to bring our last misconception back around to Hannah.
Yes. So the last misconception is that ableism only comes from able-bodied people, people without disabilities. So I'd like to start by kind of explaining what ableism is for anybody that doesn't know. Ableism is any kind of discrimination or I'd say unjust treatment of people with disabilities. And then there's also such thing as internalized ableism, which is more of a mindset of, you know, how you think of yourself with your disability. So I personally have experienced internalized ableism, so I'm going to speak a bit on my experience with it and some of the causes of it and how, you know, you can kind of prevent that with people that you may know with internalized ableism. So I think that one of the easiest and simplest forms of internalized ableism is not accepting that you have a disability, which I think is a journey that everybody goes on, even as somebody who has had a disability from birth. Growing up, it's not always acknowledged in a specific way, I guess. It's hard to explain, but you know, I grew up and I knew that I had a disability, but I never understood what that meant until I got older, and it was just kind of brought to light, I guess. And I kind of understood more of what it meant. But it's just, even though it's, I guess, saying that you have a disability versus acknowledging it is two different things. So yeah, so that's one of the simplest ways. Another way that internalized ableism can be caused is by support organizations not being supportive, which is quite ironic. But me and other people that I know have had trouble getting accommodations with organizations that are meant to support you, which again is just really silly because again, they're supposed to support you, but it often comes down to not being disabled enough, which is the biggest type of internalized ableism that I've experienced and that I know others have experienced. And so these organizations can really kind of contribute to that, because if you're not blind enough for the organization, for example, I have a visual impairment, but I am not considered legally blind. So there are some organizations that will not help me. I know that I have had experiences not getting assistive technology and such. So those, of course, I know that they don't mean to be, you know, uninclusive, but they can be sometimes. Another cause of internalized ableism is feeling that accommodations are a burden or thinking it's okay if you are not accommodated. Another experience that I've had, especially in school, where so I'm still in high school, so I have my IEP still. So of course, all my teachers get it, but sometimes they're not always the most efficient with it. And my experience is that, you know, if you didn't get something as an electronic version for me, I'm like, it's fine, I'll just do it regularly like everybody else. And that should not be okay, because it's almost like you're having to accommodate them for not being able to accommodate you. And that really shouldn't be your mindset, is that not being accommodated is okay, because having your accommodations is a right and everyone should have it to be able to have an equal chance to be successful, right? So it just part of the mindset of internalized ableism, again, feeling that your accommodations are a burden or thinking that it's okay to not be accommodated. Another cause of internalized ableism, again, going back to it's not always able-bodied people causing it, is just a lack of knowledge. Anybody can be unconsciously promoting ableism by just not knowing enough. And I always like to relate back to Jacky on this, where I remember Jacky said that when she first became a True Faces ambassador, and a bit before that, she didn't know much about visual impairment. And so if you don't know about a different kind of disability, then you can, again, kind of unconsciously create that kind of ableism. Not putting any bad light on Jacky. Jacky's wonderful, and Jacky's informed now, which is great. So I'm just saying that it can sometimes be unintentional, that kind of ableism, and causing that internal ableism. And so lastly, I just want to talk about how you can kind of prevent someone from experiencing internal ableism. And that is just to kind of be open with them, to be sure to support them in any way you can by, asking them how they're feeling, if kind of what may be causing them some distress, and just having whatever kind of open conversations you can about them, of course, respecting their boundaries, but just kind of acknowledging that elephant in the room and acknowledging how they're feeling so you can try to make them feel better. And with that being the last misconception, I think we are going to go on to questions.
We are going to go on to questions, but just before we do that, I do want to bring us back to the first little visualization that I presented at the beginning, where I told you to close your eyes and picture a busy street. Now you still see that same person with a cane, and I'm curious to know, are you reacting differently? Are you picturing that person differently? Maybe they had a white cane before, but maybe now they have a guide dog. Maybe they're just standing there absolutely normal. Maybe you don't even know that they're visually impaired. Are you still doing the same thing? Are you still going to try and help them? Do you think that they can maybe just cross the street by themselves now? Or do you let them go on with their day? You can leave that in the chat if you want, or just, again, consider it on your own. And just wanted to do a little plug here for True Faces as a small business. I am currently wearing the purple version of the shirt, which is on the screen, but we do sell True Faces t-shirts that are primarily conversation starters for disability advocacy. The link to our Shopify is on here as well. And so when the presentation gets sent out, you'll have access to that. But if you are looking to support us and get involved, our website is also on my virtual background and will be included, I believe, on the next slide. So definitely check those out. And if we go to the next slide, there are all of our socials and emails as well. If you have follow-up questions, you want to connect with us on social media. If anybody with a disability on this call would like to connect and share their story on our page, or has any other future questions or advocacy comments, we'd love to get in contact. And I think there's one more slide that is just thank you for joining us. It's super appreciated by coming out today. You helped us break down these misconceptions and hopefully contributed to bettering the lives of people with disabilities. And I think the biggest takeaway from this was that education is key. So by showing up today, you have contributed to that. And I can speak for my entire panel here when I say that's so greatly appreciated. So thank you, everyone.
Well, thank you so much again, everyone, for joining us. Thank you so much to our wonderful panel. It was a really fantastic presentation. Thank you, everyone, for staying connected with Mohawk. And I hope you have a great rest of your evening.
Thanks, everyone.